Hey everybody, I just wanted to do a quick little video for, actually for a special person that I talked to last week. I'm having a hard time breathing. I'm not going to say her name out of respect for privacy, but she is experiencing a lot of the same symptoms that I had originally experienced when my journey started. You know, constant pain in the temple, back of the head, and she's kind of going through the whole runaround with doctors. And another thing she discussed with me, which was very upsetting, is some family members are not, I don't know if they're not understanding what it is that she's going through, or they don't believe her. So in a way, I'm kind of doing this, and I hope you're watching. So maybe you can show this video or pass the link along to your family members. I was fortunate enough to have my family at least believe me when I told them, and I'm still telling them that I don't, excuse me, cough attack, that I didn't feel well, and I don't feel well, that there's still, I need water, that there's still constant pain in a certain area. There are names for our condition. It's neuralgia, neuropathy, peripheral neuropathy, and I say just generally like neuralgia because that is, you know, can be any one of your nerves. You know, I happen to have it in what so far turning out to be pretty much every nerve in my head. Like I've said in so many of my videos, you can't explain how this feels and how bad it feels, and also the guilt that comes along with it, because medication doesn't really help. It helps take the edge off it. You know, I'm on 2 nerve medications, and I can't even imagine what I would feel like if I wasn't on the nerve medications. But, you know, the trips back and forth to the doctors, and I'm so fortunate that I finally, trust me, like y'all know, I went through over 2 years of so much frustration, not knowing what was wrong, but I'm so lucky to be at Georgetown University Hospital, being treated at the neurology department, and having Dr. Duchek as my surgeon. So I know all of you out there don't live in our nation's capital, but this is a real condition, and it's so debilitating. And sometimes the pain, you have your peaks of, like, some days you're at a 6 or a 7, and some days your pain is off the chart to the point of, like, it's so inhumane that just you go to a dark place. And, you know, like I've said, laying in bed, surgery after surgery, as I had to recover, I always told myself that I had to do something, because when I would research, there was nothing out there. There are no support groups. There's nobody to talk to. So with the foundation that, you know, it's just trying to raise awareness that this exists and it's real. And yeah, again, we don't have blood coming out of our eyes or our ears, and we may look fine on the outside, but you cannot even imagine what we're going through on the inside and how bad it hurts. And to those of you out there that are haters or trolls or just think that we're faking, why would we want to fake this? Like, I used to get up and like go to the gym and come home and get dressed and put my makeup on and get in a pretty outfit and put my heels on and go to work and be sociable. And I had a social life and I had friends, and I used to be able to, most importantly, be a good mom to my children, take care of them and run a household and be a good wife. So why would I all of a sudden just be like, let me pretend that I have chronic daily head pain so I can just lay around and in complete agony. Let me fake it. Like, let me ask you all out there, like, who would want to do that? A real sick person would want to do that, because like I've said, I would give anything to be in rush hour traffic, coming home from work and being like, oh, I got to go to the grocery store still and grab milk because we're out of it. I still have to go home and make dinner. I have to give Ella a bath. And I can't do any of that stuff. I can't even pick up Ella. I have to get down on the floor and get squeezes and hugs from her and kisses. Or she jumps up on my bed or the couch to get her hugs and squeezes from her mom. So, go to the website, purplewithapurpose.org, and click on my doctor's link, Dr. Duchek. He's a chief surgeon at Georgetown University Hospital. This isn't made up. This is real, unfortunately. I would give anything, and I'm still waiting. I'm still recovering. And unfortunately, I have another problemed area. And my like I've said, my story isn't going to be like everybody else's out there. Mine's just been a really long journey. And I'm hoping by raising awareness that people won't have as long as a journey that I've had, because I can help guide people to a good neurologist or the proper surgeon, maybe wherever they live, or I can help them get to DC and to Dr. Duchek. So what we need, if you are maybe watching this saying, well, what can we do as a family member or a friend, is just be supportive. Just let your loved one who may be suffering from this know that no matter what, that you're so sorry. So sorry that they have to go through this, and that they can't be a mom to their babies, or a wife to their husbands, or that they can't even be like the person that they were, that they're so empty inside. Just come over, go to their house if you have a second or some time, and just ask if they can. Do you need a load of laundry done? Do you want me to make dinner for your family? Do you want me to pick you up and take you to get a manicure? Do you want me to, I don't know, do you want me to just sit with you and just talk and take your mind off of how horrible you feel inside? That's what you can do. Just be normal. Be compassionate. Because if it was any other disease, if they had cancer, God forbid, and they were balding and you saw them so sick from chemo, I'm sure you would be right there by their side. And I'm emotional because I feel like there's still so many ignorant people out there that don't believe that this is real. So please go visit the website and look at my doctor's website, because I'm pretty sure a chief surgeon at Georgetown University Hospital wouldn't make something up. And I'm pretty sure he wouldn't operate on me 5 times and tell me and my family that he found horribly damaged nerves with blood vessels wrapped around them.
So I just wanted to do this for, not me, for people like me who may be having a hard time explaining it to their families. Like I said, I was fortunate enough to have my family believe me. I mean, maybe my extended family who isn't really around me every day and I don't talk to, maybe they have a hard time believing or understanding, but I come from a very big family and I was always raised with nothing but love. And that's all that we really need is love and support, not so many questions. I mean, maybe you can ask questions if you want clarification, but not questions out of because you don't believe. The person suffering just needs your support and just needs love. And if you can't give that, then you need to stay away from them, because one of my doctor's orders, along with the lengthy list, is to stay away from stressful situations and to not have conflict or, in your life, that you have to focus on yourself and getting better and getting rid of the pain. And then when that is all done, then you can deal with whatever needs to be reconciled or resolved. But right now, there's so much going on that's way more significant. So I hope this video helps. If anybody out there's suffering and they're having some hard times with their family or loved ones or friends even. As always, I hope everybody's doing well. Love and healthy thoughts to you all. Bye.